Welcome everyone to another wonderful episode here, Doctors of Podiatry. Very interesting case. We are actually performing a Bifecta procedure. We have a very young patient who has presented for the first time to see us today here at Doctors of Podiatry with a significant amount of pain to the medial aspect of the ankle. The patient has a flat foot. People with flat feet, we have a very important tendon called the posterior tibial tendon. This tendon plays a very, very, very important role in the way that we walk. Unfortunately, during the course of the last 6 years, this patient has been battling this pain. It's incredible. We were talking about it before, that even throughout her daily life as what she does for a living, she's been able to push through for the last 6 years. And finally, I think this is kind of like the tipping point. She has decided to come in to seek solutions. In people with flat feet, sometimes this particular tendon, the posterior tibial tendon, will suffer a little bit, and this is not really like a tendonitis, like an inflammation. It could be a combination of inflammation with some degeneration, tendinosis, maybe some little micro tears that could really be at the core the problem. So before it gets really, really bad, I've recommended that we perform a platelet-rich plasma injection in conjunction with an ozone injection. And both of these procedures are fall under the category of regenerative injections procedures. So we're going to go ahead and do that today. I basically just come around here, Melissa. So basically, we have the tibia. One of three of the bones that make up the ankle joint, and I've just basically drawn out the course of the tendon. Starts here, kind of moves this way, and it attaches to one of the bones here called the navicular. And this is an area of the tendon when it makes this U-turn here. This area is very, very hypovascular, very, very little blood supply, and this is the area. If there's going to be an area where the tendon will suffer quite a bit, it's going to be right here. Okay, so we're going to go ahead and the first thing that we're going to do is we're going to perform the PRP injection. That's exactly what we're going to do first, and then we're going to go ahead and let's keep it like that. We've already isolated the PRP. Okay, so we've done that already. Okay, come around here. There we go. So I've already told the patient, just like for all the viewers that have that are familiar with PRP, I always tell the patient prior that they're going to definitely feel some discomfort. In this particular case, we have not used any local anesthesia. In this area, what we call the tarsal tunnel, there's more space, and historically, yes, there is some discomfort, but not as much as numbing the area. So without further ado, let's move forward. Please, Melissa. Thank you very much. And we'll just use a little bit of cold spray. Okay, here we go. Okay. And this is only one little stick. Here we go. Okay. So we'll go in. Okay. And now we're going to start infiltrating, right? Here we go. I've already told the patient to please let me know. How you doing up there?
Okay.
Okay. A lot of discomfort?
Yes.
Okay. How about now? How about now?
Burning.
A little bit of burning there. I want to be very clear with the public that these injections, sometimes we do use, local anesthesia. We're going to stop here, right? And that's good. So the patient, okay, the patient will feel
like that pain double.
Yeah. So there is an element of discomfort. But that will last about anywhere between 3, 5, 7 minutes, and then it will throb, and then it will slowly go away. Now, what I'll do is I want everyone to see this. So now what we're gonna do is, I'm gonna go ahead, this is the Ozone, right? It's an ozone generator. And what we're gonna go ahead and do, it's filling up, as everyone can see here, and that's it. So again, this is ozone gas. Okay, you like that, right? So we have ozone, believe it or not, this is a gas. We've taken medical grade oxygen, which is O2, 2 molecules of oxygen, and we put it through an ozone generator. So what's on the other side, what I have here is ozone, which is 3 molecules of O3. We've gone from O2 to O3. O3 is a very, very hyper molecule. And when I inject it now, it's gonna actually separate again. And there's, just to keep everything very, very simple in lay terms, the reaction that it causes in the area, in this case, the affected area, it actually helps the area heal. This is a great alternative as well. Whether it's used with PRP, microtenotomy ozone, or ozone alone. This is not, I want to be very, they're not looking for me, I promise. What I want to be very, very clear, this is not going to be painful at all. This is only gas. And if people are wondering, well, how's that possible, injecting gas? Yes, we are. Okay, so the only thing I'm going to tell the patient is that she is going to feel a little pinch. Okay, and that's it. Okay, here we go. And the most important thing here, little pinch, is there's a very important artery. We want to make sure that we don't inject the gas into the artery, right? That's a no-no. And as everyone can see here, look how it kind of inflates. You see that? And that's it. Did that hurt? Good.
This is the first part.
The first part, yes. So we don't want to obviously press on this or anything. How are you feeling?
It's just discomfort.
Is it going away slowly?
When you test it, it kind of like throw off.
It'll throb again about 5-7 minutes. You know, we're very transparent here. We don't edit anything. I think it's important for the public to see, to really know ahead of time when, you know, if they're considering these procedures, you know, what to expect before they come in. I'd like to take this opportunity, obviously, to thank the patient for participating in this video today. What we are going to also do today is we're going to fit the patient for a pair of custom molded what we call UCBL orthotics. They're indicated for this clinical presentation. Patient's very, very young, and my concern is it's not really for the treatment, but also, more importantly, the prevention of this problem, getting worse with time. So the 2 stages, first stage is the treatment of the problem, PRP, ozone injection, first part. Second part, in about a month, they take about a month to fabricate. Then she'll come back and those will be ready. We'll transition from an ugly boot to an ugly shoe to eventually the close comfortable shoe with the orthotics. www.JellsPodiatry.com, Instagram, Dr. Tojam, Gels Podiatry, Facebook, and last but not least, our YouTube channel, Gels Healthcare. If anyone has any questions, you know where to find us. Have a nice day, everyone.